Rhiza Babuyile has opened a R5-million community clinic to provide accessible, advanced and quality primary health care to Diepsloot Community in the north of Johannesburg. The new state-of-the-art community clinic is said to be the first of its kind, offering primary health care services to the poor in that area. Through a partnership with the Gauteng Department of Health, the clinic will be assisting the government with its child immunisation program, family planning services for young women and the ongoing COVID-19 vaccine rollout. Let's get more on this then. We're joined via Zoom by the Chief Operating Officer, Rodney Makube. Very good afternoon to you, and thank you so very much, Rodney, for joining us here on SABC News.
Good afternoon, thank you.
I mean, this is great news. I mean, generally we're covering, bad stories that are perhaps coming out of Diepsloot. Let's talk about, the construction of this clinic and the motivation for the organization to build this clinic.
All right, so it is an exciting journey for us as Rhiza Babuyile for the clinic that have been built, which was launched last week, the 7th of June. So it is exciting because we have been operating from mobile clinics within the community of Diepsloot for about 10 years. But mobile clinics has its own limitations. The number of patients we can see per day is limited. We did not have a proper waiting area. We could not actually render the quality that we wanted to do, even in terms of scale. We could not scale the way we wanted. So this new clinic actually offers us an opportunity to serve more people from Diepsloot and actually give them sort of a property where they can be assisted for something of quality, something that speaks value, something that speaks respect. So yes, it is exciting for us and for the Diepsloot community.
I also want to ask about, when you're talking about excitement for the community, are we also talking about employment opportunities? I mean, I would imagine that a high-level clinic such as this would require quite a few personnel for it to operate from the ground up. I mean, are you indeed hiring from people in Diepsloot so that indeed they can say this is their clinic and that their people are working there?
So for us as Rhiza Babuyile, we stand for development of local townships. And if we stand for development of local township, obviously if we operate in a particular township, our priority becomes the people who stay there, particularly the youth and women. So our clinic's model is in such a way that we normally employ nurses, which in terms of nurses, professional staff, you don't really have control, even if you prioritize the local community, but you might find yourself hiring from outside. But a bigger part of our employment is community healthcare workers, which at the moment we've got around 15 of them, which are coming from the local Diepsloot community. Obviously, we're going to have to extend in terms of administrative staff. And of course, we will prioritize, especially the young people who are staying in Diepsloot.
Yeah. The Gauteng Department of Health has been heavily involved in your project. Firstly, how were you able to motivate for the department to indeed get involved and certainly where we see the clinic actually operational? Because a lot of people have been talking about the issue of accessibility to the government and being able to, and I would imagine there are other communities that want to build similar structures.
So I think for us, it was not that much of a motivation. It was more about doing what you are doing it well. And when you do what you do and you are doing that well, it's easy for you to attract partners. So that we have been working along with the department, but they've seen what we have been doing. They've seen our passion in terms of improving the health of townships. And with that observation, I think it was easy for them when we say, okay, how can we help? Because that's normally our approach. How can we help? And obviously the extended immunization program became a niche of this is something that we want to do. We want to make sure that all children are reached with immunization. So that's where we started getting involved with the Department of Health.
All right. Thanks very much for talking to us.